I definitely remember exactly how we were told that Drake has cancer. The oncologist came in and said, I have some really tough news to share with you. I do remember she said he's going to be okay, but he does have cancer, and we're trying to determine the specifics, but it is a type of leukemia.
So as a pediatric oncologist, when we're faced with treating a child like Drake or any other child with cancer, our ultimate goal is to do whatever we can to use the medications at our disposal or the treatments at our disposal to cure that child. But it is a very heavy-handed approach. I mean, I'd like to use the analogy that this is like using a big hammer to treat everything across the board.
As soon as they started the treatment, not only did he have the pain from the leukemia, he then couldn't walk because there's a drug that causes nerve damage. So then we had to then take medication for that nerve damage, which also had side effects. He lost his voice because of one of the drugs completely, so he couldn't even communicate. He couldn't do anything independently. So basically, he went from being a happy, rambunctious 3-year-old to that of an infant. And that's really scary.
So the focus of my research really is in optimizing treatment of all children with cancer to optimize efficacy while minimizing the risk for severe or irreversible side effects in these children. And what that really boils down to is coming up with not only the right medicines to use, but also the appropriate doses of medicines to use, so that we end up curing and continuing to cure as many children as possible, while leaving them with a lifetime of health.
Day one is a day I will never forget, because that's when you see how many drugs they're receiving and all of the possible side effects. And you see those side effects on paper, but you also see them in your child. Even though this particular research project will probably not benefit my child, knowing that we're helping other families who are going through this life-changing experience just means the world to us.
If you were to fast forward into 20 or 30 years from now, in how we as a field of pediatric oncology will be approaching treating kids like Drake, I hope and I expect that it will be vastly different in that I think we will be at a point where we can take a very personalized approach in treating each individual child, but it really starts with donor funding to help move these programs, to develop the foundation and move these programs forward that ultimately lead to improved outcomes for every patient.